Welcome to The Explainer. Today we're going to talk about something that's super common during cancer treatment, but maybe not talked about enough, and that's gas and bloating. We're going to get into why it happens, and most importantly, I'm going to walk you through a really practical guide to help you manage it. So if you're going through treatment, does this sound familiar? That really uncomfortable pressure, that fullness, just that bloated feeling in your stomach? It's so frustrating, right? And it can seriously impact your whole day. Okay, first things first, you are so not alone with this. It's a really, really common issue. But the best part? There are things you can actually do. Real, practical steps you can take to start feeling better and get some of that control back. All right, so let's dig in. What is this cancer bloat thing, really? To get a handle on it, we first need to understand what's going on inside your body and, why it's more than just a little discomfort during treatment. So when we break it down, it's pretty simple. It's just too much air or gas getting trapped in your digestive system. Now, a little bit of gas is totally normal for everyone. It's just part of digestion. But during cancer care, it can really ramp up and cause some serious discomfort. And here's why this is so important. It's not just about being uncomfortable. This can cause actual pain and cramps. It can make you lose your appetite, which is the last thing you want when good nutrition is so crucial. And believe it or not, for some people, it can even mess with the accuracy of radiation treatments to the pelvic area. So yeah, getting this under control is a really big deal for your overall care. So the big question is, why is this happening? Why is it such a common thing for people in cancer treatment? Well, there's not just one single reason. It's usually a mix of a few things, and they're all tied directly to the care you're receiving. A lot of the time, the treatments themselves are the main culprits. Things like radiation or some types of chemo can just change the way your digestion works. Maybe you're trying new foods or nutritional shakes. Other medications, like antibiotics, can throw the good bacteria in your gut all out of whack. And then there are the simple things, right? Like using a straw or chewing gum. You'd be surprised how much extra air you swallow doing that. Okay, now for the part you've been waiting for. Let's talk about what you can do about it. We've got a 4-step action plan. Real, tangible things you can start doing to take back control. So here's the game plan, all on one slide. First, we're going to identify what's causing it for you. Then, we'll look at changing some eating habits. After that, we'll talk about balancing your fiber. And finally, we'll touch on how you prepare your food. We're going to go through these one by one. All right, step 1. Time to become a little bit of a detective. For the next week or so, just keep a simple journal. Write down what you eat, when you eat it, and, this is key, how you feel afterward. Do you notice bloating, gas? This is honestly the #1 way to figure out your personal trigger foods. And to help you with that detective work, here's a handy little cheat sheet. On the left, you've got the usual suspects. Things like beans, broccoli, soda. On the right, you've got foods that are generally a lot easier on the stomach. Think of this as a starting point as you figure out what works for you. Okay, step 2. This one's a game changer. It's not just about what you eat, but how you eat. Think about it. When you eat super fast, use a straw, or chew gum, you're swallowing a ton of extra air. So, just by slowing down, chewing your food really well, and maybe having smaller meals more often, you can cut way back on that extra air. Step 3 is all about fiber. And fiber, well, it's a tricky one. It's like a double-edged sword. Not enough can be a problem, but adding a bunch all at once can make things even worse. The absolute key here is to go slow. If you need more fiber, just add a little bit at a time over a week or two. Let your body get used to it. And now for step 4, making a few small tweaks in the kitchen. Seriously, this can make a huge difference. Try cooking your veggies until they're really tender. If you're having beans, soaking them beforehand or just rinsing the canned ones really well helps a ton. You can even look into something called low FODMAP cooking. Little changes like these can make those tricky foods way easier to handle. Okay, so that's the 4-step plan. But what about when you just need some relief right now? Well, there's a whole toolkit of other things you can try. Let's start with some natural strategies. Just a gentle walk after a meal can work wonders to get things moving. A warm compress or a heating pad on your belly feels amazing and can relax those muscles. And lots of people find that a warm cup of peppermint or fennel tea is really soothing. Okay, this next part is super important, so listen up. Before you even think about trying any over-the-counter products, you absolutely have to talk to your care team. Your body's going through so much right now. Nothing new. No pills, no supplements without getting their okay first. Promise? All right, so once you've had that conversation, here are a few things you might talk about. There's simethicone, that's Gas-X, which helps break up gas bubbles for quick relief. Then you've got digestive enzymes like Beano that you take with your food to help break it down. And maybe you'll discuss probiotics for long-term gut health. But again, that is definitely a conversation for you and your doctor. So we've talked about all these different ideas, but what does it actually look like when you put it all together? Let's walk through a sample day to see how you could make this work. Okay, check this out. You could start your morning with some warm peppermint tea and some easy-to-digest oatmeal. For lunch, maybe a grilled chicken salad, and then you take that nice gentle walk we talked about. A simple snack in the afternoon, then baked salmon for dinner. See how it's all about smaller meals, gentle foods, and a little bit of movement? And you can cap it off with a nice cup of fennel tea before bed. It's all about finding a rhythm that works for you. Okay, last section, and this is maybe the most important one. We need to talk about your safety net. It is so critical that you know when this is just discomfort and when it's something more serious. These are the red flags, the symptoms where you don't wait, you don't see how it goes. If you experience any of these, you pick up the phone and call your doctor or your nurse immediately. Let's be super clear. We're talking about severe pain, especially if your belly is swollen. If you haven't been able to pass gas or have a bowel movement for 2 or 3 days, that's a call. Any fever, any vomiting, any rectal bleeding along with the bloating, that is an immediate call to your team. Don't hesitate. So, when you boil it all down, the biggest takeaway here is that you have options. You can play a huge role in managing this. So I want you to think about it. What's just one small thing we talked about today that you could try? Maybe it's just keeping that food journal for a few days, or trying that little walk after lunch. Whatever it is, what's that one thing you can talk to your care team about this week? Because that conversation, that's where feeling better begins.